Hello everyone, and welcome to this audio podcast. This audio podcast, as part of the LabZtorm and Diggamount. This audio podcast, as part of the Coppola and Storm and Labostics. This audio podcast, as part of the Shipmo Squad, and this audio podcast, as part of a Storm Labostics production. Through this audio podcast, a little bit in around looking at transfusion, red blood cell transfusion, or RBT transfusion, sorry, RBT alternatives. So the use of EPO or erythropoietin to increase erythropoiesis, erythropoiesis being the process of seeing a sort of an increase in red cell production, red cell synthesis through pathophysiology, offers in some bases sort of an alternative to RBTs, but not entirely, and assuming at the same time a normal responsive progenitor cells and adequate iron, folate, and cobalamin stores are also correct. So prospective investigations should examine or investigate whether clinical outcomes from EPO use in SCA or thalassemia patients or recipients is effective, and because at the same time platelets the components are referred to as platelets. Platelets play an instrumental and play an important role in the primary homeostasis. Platelet transfusions are often important in managing patients or recipients who are at risk of bleeding with thrombocytopenia, with low platelet with thrombocytopenia, low platelet, or impaired platelet function. Um, but at the same time, platelet transfusions carry risks, and decisions to transfuse platelets must consider clinical circumstances. Um, and because platelet transfusion in such settings may fuel thrombosis or clotting, and worsen clinical signs and symptoms or symptomologies, and more issues for transfusion where have been highlighted, even when considering pharmacological alternatives or RBT alternatives. So alternatives additionally to RBT should be given strong consideration. However, more focused evaluations of specific chronic illnesses, again in around SCA and thalassemia patient and populations, for example, and transfusion alternatives would help to clarify best use of treatment modalities. Um, Recombinant EPO has been proved to be important as a treatment modality in managing anemia in context of eGFR, where there's eGFR impairment, and other uses are pre-autologous RBTs. The anemia of chronic conditions, for example, in around rheumatoid arthritis or particular cancers, forms of sort of oncological conditions, and some cases of myodysplasia or myeloma, and acquired immune deficiency syndrome. So uh, a low serum before prescription is important to understand whether the patient will respond, whether a patient or recipient, for example, with SCA or thalassemia, will respond to a treatment modality. Um, So, additionally, in a part of this, research to understand and identify suitable treatment alternatives, treatment treatment pharmacological alternatives to for example and indications to RBTs for patients or recipients with with CIs. Again, SCA or thalassemia is important more now because of where the clinical factors because where the clinical factors the clinical factors in around condition the in around the SCA and thalassemia CI can implicate in the longer term in around EGFR EGFR health. Uh, uh, at the same time, just to inform that there have been some works in around the use of other erythropoietin or erythropoietin like stimulating agents or ESAs, and again there have been signs that there have been signs in amongst aspects of guidelines, for example the sort of the increasing use or requirement in around RBTs in the past decade in the past decade or so, and so therefore at the same time as per mentioned in part of this audio podcast series or chapter, it is where the donor recruitment for those who require a sort of red blood cell transfusion is or has been at the same time become more challenging because of where SCA where there are there are different differentiations in the types of SCA and thalassemia. Therefore, the donor recruitment for those who require RBTs is and has become more can be, is and has become more sort of challenging or difficult depending on where SCA or recipients or patients can be. So that draws this audio podcast to a close. This audio podcast is part of the LabZtorm and Diggamount. This audio podcast is part of Cupola Storm and Lobostics, and this audio podcast as part of the Shipmo Squad, and this audio podcast as part of a Storm Lobostics production.